I'm Mara Tripathi.
Hi everybody, I'm Shukla.
Today's topic is type 2 diabetes. So, Dr. Shukla, what is diabetes, first of all?
Diabetes is increase in blood sugar, which causes different complications.
Okay, so I've heard there's type 1 and type 2.
Mm-hmm.
What's the difference between those two?
So type 1 is more autoimmune, where your pancreas, which is the organ that is responsible for handling of all the blood sugar, is slowly killed by your immune system. Whereas type 2 diabetes is more of fat deposition around pancreas, making the function of pancreas challenging, but the pancreas still exists.
Okay.
Type 1 is more seen in younger people, whereas type 2 is more genetic, seen in more middle-aged too. Now it's getting younger and younger people are getting type 2, but traditionally develops over time, more related to lifestyle. Type 1 is more autoimmune, younger.
Which one's more common, type 1 or type 2?
Type 2.
Type 2. Okay. What are the common symptoms of type 2 diabetes?
Type 2 diabetes more commonly is asymptomatic. It's discovered incidentally.
Okay.
If someone were to have very severely high sugar, they could develop polydipsia, as in increased thirst, polyphagia, increased desire to eat, and polyuria, urinating multiple times more often, and more volume of urination.
Okay.
These are more classic symptoms, I would say, are seen in children with type 1 diabetes,
right.
Where sugars can really go super high really quickly. Whereas type 2 is more subtle in the background, and that is why we screen more often.
Okay, so is type 2, can you develop type 2 yourself, or is it passed down genetically?
Both.
Both?
There is both genetic and environmental contribution to how it manifests. So you could have the genetics for type 2, but if you develop your lifestyle habits in a certain way, you could inhibit the expression of those genetic predispositions.
Right. So how is type 2 diabetes diagnosed?
It's on a routine screening for most people. When you're going to your doctor for your regular checkups, which I encourage after a certain age, definitely after the age of 35.
Yeah.
That is when it's diagnosed. For women, it's during their pregnancy, during screenings. And then rarely it's first diagnosed if people are not engaging with the doctors on a regular basis. It's really severe symptoms. Sometimes for some unlucky people, it's their first stroke, first heart attack when they're diagnosed with diabetes. So you don't want to be that person.
Right.
And that's why I go and get your screenings done. As in, when you don't have a problem and your doctor looks for health issues, that's called screening. And that is what I recommend for type 2 diabetes.
You want to catch it early?
Correct.
What dietary recommendations do you suggest for someone with type 2 diabetes?
The diet has a big role in type 2 diabetes. Like we were talking earlier, you could have genetic predisposition, but it could be controlled by lifestyle changes. Among the lifestyle changes category, diet is really 80% and 20% is your exercise.
Yeah.
To put it in simple, some simple principles would be avoiding ultra-processed foods, having lots of fiber. The standard American diet, also known as SAD, is deficient in fibers. Fibers bind to glucose, and the glucose is released more slowly. It doesn't cause spikes. So choosing certain kinds of food over the others. And then timing of meals is important. Not eating super late at night, which only triggers your body to store your energy as internal body fat, known as visceral fat, instead of expending the energy. Those are some basic principles that we can all follow to prevent type 2 diabetes.
Right. So does fried food play like a big role in this?
Yeah, so fried food, definitely.
So you'd rather eat like some grilled chicken than fried chicken or something like that?
Yes.
It'd be a lot more helpful.
Basic, the less processed it is.
Right.
Yes. Yeah.
Okay. So how do medications for type 2 diabetes work?
Right, so after the lifestyle changes, well, I would say that lifestyle changes never disappear. You always, even with medications, you would want to continue to eat healthy and exercise. Medications are important because sometimes we are in that cycle or spiral of where exercise is just not enough to, or eating clean is just not enough to get you out of that insulin resistance, whereas your insulin is just not doing what it's supposed to do.
Yeah.
Then we have medicines called insulin sensitizers, like metformin is the cheap, basic first-line medication that helps insulin relearn what it's supposed to do. Insulin is the basic hormone which goes wrong in type 2 diabetes. It's like a traffic controller. And let's say you're consuming calories because you are hiking or you're running. That's the natural system is of our body. And insulin is the traffic controller. You got food because your muscles are working. When you have insulin resistance, insulin gets confused and it thinks the food is never going to come back again. So this is my chance to just store the food.
Yeah.
So it sees food and says, hey, don't go to the muscles, go to the liver, go to the pancreas, just store around it as body fat. So that's really insulin resistance. Insulin sensitizers like metformin basically make your insulin work normally, that all your energy should go to the muscles instead of getting stored in liver or internal body fat.
Okay. Yeah. Can type 2 diabetes be reversed, and like if so, how?
Technically, yes. You'll always have the genetic element. Once somebody is diagnosed with diabetes, we unmask their genetic vulnerability, so you know that this person is more vulnerable than XYZ. At this point, most humans are. You know, just by how humankind has progressed and our environmental changes. I would say everybody's at risk for diabetes, some people more than the other. Once you get a diagnosis of diabetes, you know you are more vulnerable to have higher sugars than XYZ person if you do the things like eating processed food or not exercising. Mm-hmm. So I have seen younger people, when you catch diabetes early, put it into remission without medications. So I have had, the norm is most people need medications, but there are outliers. There are people who were eating the wrong things, who were not exercising, and when they did all those things, they did not need medication. They were able to reverse diabetes, so as to say. But they'll have to maintain that for the rest of their life. So in our world, we call controlling or managing diabetes. Mm-hmm. Diabetes is under good control is how we phrase it. We never say diabetes is gone.
Yeah, right.
We never say we reverse diabetes. We say diabetes is under good control. For that
so if
reason.
you like stop your lifestyle changes, it could just pop it back again?
Pop it back, exactly.
Right.
So for that reason, the terminology we use is just control instead of saying it ran away.
Right. Are there any new like treatments or research for like type 2 diabetes that are going around?
Yes, so with type 2 diabetes, now we have learned the spectrum of obesity, prediabetes, and diabetes is the end stage of this spectrum. So the thought process is to intervene early at the stage of obesity. So the new obesity medications, which are also diabetes medications, like the known as GLP-1, and agonist treatments like Ozempic is a popular name you might have heard.
Right.
There is Mounjaro, which is another step up from GLP-1.
Yeah.
It's GLP-1 with GIP-1. These are some peptides which are basic neurohormonal chemicals in the body that help with the gut and the brain connection on how your gut communicates with the brain whether it needs food, and helps direct insulin to do the thing that we were talking about earlier. Right. So that corrects diabetes and obesity issues at a very basic root cause pathway. Mm-hmm. So those have shown amazing results, and is going to be a big game changer in how we're already seeing a dip in the epidemic of obesity and diabetes. It is only going up and up and up. Now we've seen the inflection point come down.
Yeah, with the new research.
Yeah, in 2023 we saw an actual decrease in incidence. So
that's great.
So there's a lot of promise with these newer agents. There's more amylin analogs. So there's more in the pipeline, but right now GLP-1 and GIP-1 is your best treatment.